R.BHUSHAN, welcome to the program ASG IAS. ASG IAS believe in quality, commitment, and success. Join our Success Foundation course. Women after 40, some bony issue. Decreasing bone strength is a very common health hazard for women over 45 years age. It's a painful and crippling. This is called osteoporosis or porous bones, which is never considered a disease but a normal routine degradations for women or a discredit for women, especially in rural India. Why should you at all fear osteoporosis? Besides being a painful and crippling condition, chances of bone fractures increasing considerably in osteoporosis. Even a minor fall or forceful hug may cause a fractured bone which heals very slowly and sometimes not at all. Many cause long-term disability and accelerated death rate. It causes marked changes in the posture as a humped back, which is considered a stereotype of the aging, especially in our country. Deformed skeletal framework PUSs or shift various organs, which result into a spectrum of the difficulties ranging from the constipation to breathing problem. There may be a chronic low backache, restless arthritis, and leg cramps. Causes of the problem. What you are suffering today is a culmination of a slow process that started decades back. We usually visualize bone as a solid, rigid, and inactive mass, but in fact it is an active, living tissue. Sometimes recycled inner part of the bone always breaks down, and the outer surface is always the process of reformation. The delicate balance of the two processes responds to the demand of the body, which is maintained in the youth, gets disturbed during old age. More calcium is very needed for both the bones. Calcium is withdrawn from the bones from deposited. As a result, bones become porous and weak. Actual cause of this disbalance is still not known. It may be hormones or genetic predisposition, nutrition, physical activity, lifestyle factors, or probably a combination of all. The female hormone oestrogen may be cited as a cause because when its production stops due to ovarian atrophy, the process of bone degradation accelerates. Also, deficiency of calcium and vitamin D, C, E, even in the healthy adult, have been blamed to be cause of osteoporosis. Who is at risk? Anyone having the following factors may be at risk of the developing or accelerating the process of osteoporosis. Family members having bone disease, those having short stature and thin build, those who are fair skinned, if ovaries been removed before the age of 45, those who are childless, those who have been confined to bed for a long period, those with diabetes, kidney or liver disease, those with underactive thyroid, those leading a sedentary life, those who is smoking, and those on a diet who fast frequently. Although it is almost unavoidable, you may be sufficiently delay the onset of the osteoporosis, reduce the intensity, and the cope with the problem arising due to it by following these tips. Add extra calcium in your diet. Calcium is essential for bone health. The daily allowance of the calcium for women prior to the mesophase is 1000 milligrams per day. Mesophase is 1000 milligrams per day, and after mesophase is around 1500 milligrams per day. Take plenty of dairy products, turnips, fish, especially those which are eaten with bone, dates. Ragi is very good for source of ragi is very good source of calcium. This can be taken in the chapati or in some other form. Calcium supplement in the form of the medicinal preparedness may be a cheap and desirable alternative. Take about 1 to 1.5 grams of elementary calcium, the amount of the calcium in the product per day according to your menopausal status, and at least 50,000 units of vitamin D per week. Vitamin D helps in deposition this calcium in the bones properly. A proper ratio of calcium to phosphate also affect the amount of calcium absorbed by the bones. So reduce your intake of high phosphate foods. For adequate absorption and metabolism of calcium, you will also need vitamin C and magnesium. The whole business may look too rather confusing. It's better to consult your doctor. Change your lifestyle. The speed at which your bones break down depends on the way you treat your body. These are the few recommendations for changing your lifestyle. Remain active as inactivity increases bone breakdown. Even after fracture, start moving as early as permitted by your doctor. Cut down intake of meat, as it has been seen that heavy meat eaters have twice more chances of the developing osteoporosis than vegetarians. Eat more cereals, grain, beans, vegetable, nuts, etc. Avoid food containing excess fats and saturated fat, which are solid at temperature. Ghee, butter, lard, and some vegetable oils such as coconut or palm oil. However, optimum amount of fat intake is necessary before you be aware of the slimming courses of which instead insist on non-fat milk. Minimize your intake of the concentrated sugar, which are reduce acidity in the blood. Consequently, more calcium comes out of your bones. Reduce intake of foods with a high phosphate concentration, such as processed or canned meat, processed cheese, instant soup, puddings, pastries, and soft drinks, to name new. Stop me smoking and consumption of alcohol, as both these reduce amount of estrogen in blood that leads to increased bone dissolution. Limit intake of coffee and tea. Limit intake of coffee and tea. Make exercise a routine. Like muscles, bones grow stronger with use. Bone intensity is well noticed. Women depends directly on how much the bone is stressed. Though exercise should be started at an early age, it is never too late. No matter how old you are, exercise can strengthen your bones. There is a limited evidence indicating that exercise is helpful in promoting bone health in post-menopausal women. The best exercise of the bone strengthening are those which put load or stress on your bones, such as jogging, aerobics, skipping, or brisk walking. Simple dancing and swimming is also good exercise. To get the full benefit, exercise should be done by 20 to 30 minutes at a pace fast enough to accelerate your pulse rate moderately for at least 4 days a week. But remember, it should not be overdone, because if overdone, the exercise may increase bone destructions at the place of the formation. So before starting the exercise program, consult your physician to know about any changes you should make due to some health problem, and that amount and intensity of the exercise you need to do. Be aware of the self-medication. Intake of the steroids, used enormously by increasing muscles bulk and almost always present in so-called rapid cure preparedness offered by a non-qualified, result in severe bone loss. Drugs for acidity which contain aluminum may contribute to the osteoporosis when intake regularly. Drugs for the hypertension, which increases amount of the urine, increase bone destruction by removal of calcium in the urine. For such drugs, calcium and vitamin D supplements should be taken after consulting a doctor. Thank you so much.